Welcome in, everybody. We're trying out a new thing here. So, we actually have two streams going right now. We have one in horizontal mode, which is what we've normally been doing, and also doing one in vertical. So, uh, if there are some tech issues or weird visual issues, hopefully we can figure that out later on. I can see both views on my studio screen right now, which is super cool. Yeah, Jamie says, "Ugh, vertical, ew." Yeah, well, that's what the young people are doing now. So we're trying it out. Hopefully, it should go out to the shorts community and stuff, because there are people that watch from there. And Miranda, I do see your comment about the Patreon message, and I will look at that after the stream today. This episode is or was a suggestion by Miranda after Ember's stream this past week, addressing a very concerning thing that has been happening with regard to the trans community and misinformation about transgender healthcare, and especially this particular issue is anti-trans propaganda that has been greenlit for university teaching, for continuing education credits. There's some stuff in development about all of this. The universities are kind of looking back and saying, hey, maybe this wasn't a good idea to greenlight these organizations, but we will look at this in more detail. Today will be less in-depth science-y and more just getting a feel for what the situation is and what this means, kind of in the fight for trans rights. And I see we have a few people joining us. We got Kyle, Miranda, Jamie, Average Jesse Bell. Welcome in, all of you here. So let's get into this, shall we? And I think I don't. Oh, that view doesn't work as well. Okay, we're gonna do nope, not that one. We're gonna do this one. Okay, trying to play with the screen as we're here. So we're taking these articles from Erin in the morning. She does some really good journalism on trans topics in the news, like current events. So we have this one is from October 29th. So this is when kind of the initial issue happened. So uh, essentially, there's this group called the Society for Evidence-Based Gender Medicine, and this is important to. Oh, and we got a Bree raid. Welcome in, Raiders. Um, but what they're doing here clearly. So evidence-based medicine is a legitimate uh, thing that's being pushed now in medical education. It's essentially, how do we look at clinical problems? How do we look at developing the field of medicine? And it's seen as progress. It's seen as, how do we make medicine better for people in general? And here's Ember in the side chat. So some of the stuff may have already been covered by Ember this week. So hopefully we'll add a little bit different of a perspective. Or if you didn't get to see Ember's stream, maybe this will be your first time seeing this issue. But evidence-based medicine is kind of a newer idea. I mean, we've been teaching evidence-based medicine horizontal. Yeah, there's two streams going on at the same time, so take your pick of which view you prefer. But like, evidence-based medicine has really been in effect since the dawn of medicine, right? So we're trying to use good critical thinking skills to evaluate, how do we get our information? Where do we get our information? Are we doing appropriate studies? Are we making our protocols and our guidelines based on the evidence? So that in itself is an okay thing. Like, I'm not against evidence-based medicine, but here's the problem. When you're using the term that has some positive connotations, such as evidence based medicine, and then using it. And Miranda hits the nail exactly on the head. When you use this terminology to then promote problematic ideas, that is manipulative. When you're using it to reinforce a bias, saying that your bias is evidence based when it really isn't. So, what they did here, so they're trying to lean into evidence based medicine, but they're sliding in the word gender. So, Society for Evidence Based Gender Medicine, which gender medicine is not what we call trans healthcare, right? So, when we talk about transgender healthcare, we typically refer to it as gender affirming healthcare or gender affirming medicine or transgender medicine. So the fact that they're using this phrase gender medicine is not something that's really established. It's not a term that's being used, but they're throwing that in there to say our stance on transgender healthcare is evidence based. And unsurprisingly, they don't really provide evidence, even though they're claiming to be an evidence based medicine group. Um, but they have been deemed by the Southern Poverty Law Center as an anti LGBTQ hate group for its role in proliferating pseudoscience and transphobic policies. So let's dig more into this. Oh, Ember focused more on the GenSpect story because they're still active. Yeah, and Ember, we are going to touch on that one as well. So my goal is to kind of hit on the WSU story and the GenSpect story because they're both the same issue, just different organizations. And this hints at a very big problem um, with how these pseudoscientists, gain a following and gain attention. This is the same exact rhetoric that chiropractors will use to sound legitimate. It's the same rhetoric that naturopaths will use to sound legitimate. It's using the jargon that is going to be seen as well educated, well thought out, evidence based, and twist it a little bit or use the language slightly differently so that the lay people don't really know what's happening. And that actually uh, an issue with one of the people who kind of coined this Society for Evidence Based Gender Medicine term actually was not fully aware of what was going on with this organization. So, yeah, and this is the original article. We will get into the updates after this. So, the Society for Evidence-Based Gender Medicine, a Southern Poverty Law Center designated hate group, received the green light to teach medical professionals through Washington State University's continuing medical education program. So, in order to be fully licensed to practice medicine, and in order to keep your board certification, you have to have a certain amount of CMEs. So, like clinical education hours. So you can get those a multitude of different ways. A lot of them you go to certain classes that teach you about various topics. You can do like a lot of conferences will count for that. So if you go to Kidney Week as a nephrologist, or if you go to CHEST, which is the conference for critical care and pulmonology, if any of those will usually count for CMEs. Math Pig, welcome in. And Ryan, welcome in as well. And pretty much all healthcare professionals have to maintain some level of CMEs in order to maintain their licensure. So I know that EMTs, paramedics have to get CMEs, nurses have to get CMEs, doctors, PAs, nurse practitioners, all of them, pretty much everybody has to get a certain amount of CMEs in order to stay licensed. So the fact that they're trying to use uh to do this to help people maintain their licensure, like you have practitioners who are signing up for a lot of different things to stay on the right track to not lose their license. So this is a way for them to kind of try to indoctrinate healthcare professionals into transphobic positions or gender critical positions. And yeah, Onjur makes a very important point. This is, I believe, Washington State is in Spokane, which is, yeah, it's on the more red side of Washington State. So that is an important point. But so that's kind of the foundation for how this CME thing works. Critics argue the move by WSU gives the appearance of legitimacy to a group with opaque funding and disturbing proximity to the far-right Christian fundamentalist forces. It also means well-meaning providers who want to enhance their practice with transcompetent care may be misdirected to SEGM, SEGM. I don't want to call them SEGM because it makes them sound worse. Propaganda instead of evidence-based best practices. Yeah, imagine if you were an endocrinologist, or if you are a family medicine physician who wants to do more gender affirming care, you could, like, a lot of times, if you want to establish yourself as a practitioner of certain branches of medicine that don't require fellowship, like gender affirming care doesn't really require fellowship unless you're treating minors. And even so, we could make the argument that every branch of medicine, every specialty needs to be practicing gender affirming care, because it's not just hormone therapy, it's not just surgery, it's not just puberty blockers. Like, gender affirming care is treating the whole person as a person and being aware of health issues that impact the trans community, right? So that includes reproductive health care, that includes sexual health, that includes uh, just in general knowing how to not freak out when somebody's taking hormone therapy. It's knowing how to provide psychological health care. All of that factors into gender affirming care. So let's say you have like a physician assistant who is trying to get more well versed in a variety of areas within medicine so they can be a better primary care provider. And so they say, okay, let's take this extra class in evidence-based gender medicine. That sounds legitimate. That sounds like something that they would benefit from and be able to further their practice. However, they get routed to this propaganda class, which claims to be evidence-based, but actually isn't, and is advocating for things that we'll get into here shortly. But essentially, conversion therapy. Like, they're advocating for conversion therapy in these groups and saying that that is evidence-based practice. Which, if you actually look at the evidence, we have an abundance of evidence that suggests that conversion therapy actually has worse outcomes. So I'm not sure if these are really evidence-based medical practices. Uh, and we have plenty of evidence to the contrary. So, where are we at? Yeah, most damning, critics say that listing SEGM as a CME option lends undue legitimacy to a dangerous cell of an anti-trans pseudoscience network. Yeah, I don't want any pseudoscience creeping into my medical education. No thanks. For comparison, this org would be like a group called Society for Evidence-Based Racial Medicine, for people who say brown people are filled with demons. Yeah, no, exactly. Like, this is also, it's also like saying evidence-based naturopathy, evidence-based phrenology, evidence-based eugenics. Like, that's really what we can compare this to. It's using the term evidence-based without actually being evidence-based, and therefore causing likely to cause more harm. They're an issue group that has a position on transgender healthcare, said Evan Urquhart. I'm sorry for butchering their name. A science journalist and founder of Assigned Media. Whatever they do serves that particular agenda. It's not about openness to evidence in the spirit of scientific exploration. They advocate against gender affirming care using misinformation. Yeah, scary, scary stuff. And we got some new people enter the chat. Welcome, Skeptoidius, Aunt Jur, Jess, and Purple. Welcome in. The CME series, which is available for free viewing online, which part of me wants to like review that CME series. Maybe we could play it. I don't want to give them the clicks. That's kind of the one thing. I don't want to make it seem like we're boosting their views, but it might be worth debunking that. Appears to be composed of lectures and panels from SEGM's October 2023 conference. It's marketed to a wide range of medical providers, from psychologists and physicians to dietitians, dentists, and pharmacists. Which, why in the world? Why in the world do we need to be pushing anti-trans propaganda to dentists? What does that have to do with their specialty? And yes, I just said that it's important to have gender affirming care at all levels of healthcare. It's like, and with that, it's important that your dentist knows how to ask your pronouns, knows how to use your correct name, and knows not to like out you to the public. Like, there are important gender affirming things that should be done in a dentist's office, but that's not specifically transgender healthcare. That is just common human decency. Same thing with dietitians, same things. Pharmacists, I see where they need more education on gender affirming care, because, of course, if they're going to be dispensing HRT and puberty blockers, I want them to know how to appropriately uh, like have those prescriptions written, and they need to know the medication interactions. They need to know, for example, we know that uh, taking thyroid hormone and estrogen orally at the same time can prevent proper absorption. So that's something that, yes, pharmacists need to have a deeper knowledge on that. Psychologists absolutely need to have a very, very deep knowledge on gender affirming care, because, like, honestly, yeah, physicians prescribing HRT and puberty blockers, etc. Yes, they have a very important role, but I'm going to argue that psychologists and psychiatrists probably have some of the most essential roles in all of this, because they they are managing a lot of the mental health effects of gender dysphoria and of societal stigma, and they're also helping out the wide range of ages. Psychology is probably one of the few fields that is actually going to have full management of minors, even the less high risk ones, even the youngest ones like toddlers are going to probably benefit from psychotherapy. So it's really scary when they're trying to say that, when they're trying to advocate for conversion therapy to psychologists who might not have had those ideas going into this. Um, yeah, Ember, this is absolutely, yeah, that's absolutely horrendous. And yeah, like, dentists should be aware of gender affirming care. They should be gender affirming offices. Well, like, dentists don't need to learn the nitty-gritty of how to prescribe hormone therapy. Like, they don't really need that. It's not essential to them. Um, it's just human decency. To the untrained eye, the content may seem innocuous. One lecture claims to examine the role of psychotherapy in treating gender dysphoria, which, that would be a reasonable lecture for a psychologist who wants to get better at treating gender dysphoria, because especially if you're a psychologist who trained many, many years ago and didn't have that in your uh, kind of clinical training, sure, it would be reasonable for them to get continuing education on that subject matter. However, again, they walk into a class and it's actually, what if they just pretended that they weren't trans? Well, what if you just gaslit them into believing they're not actually trans? Like that's what they're advocating for, which leads to worse outcomes. It does not prevent people from being trans. Like, you don't become trans from this social contagion. The social contagion is ignorance. The social contagion is hatred. Those are things that are taught. Those are things that you do learn from your community. I mean, another thing that, you could say is a social contagion, uh, but really is a positive is acceptance. That like being trans is not a social contagion. You cannot transmit your transness to somebody else. That's not how this works. But I would argue you can transmit acceptance. You can transmit positivity. You can influence the community around you to either be more hateful and cause worse outcomes, or you can uh, transmit your love for humanity to your community. If people are bigots and they learn that their actions are unacceptable, if they learn that they cannot get to where they want to in society by having those viewpoints, that does matter. And you can influence the people around you to take care of people better. And that's what we need. Yeah, and Ember again. In 1953, Christine Jorgensen was celebrated. In 2012, Laverne Cox was celebrated. The hate is what's new and is passed socially. Yeah, that is the real contagion here. What's going to happen if you allow conversion therapy? It is not going to make fewer people trans. It is going to make fewer people feel safe being trans. Fewer people are going to seek out healthcare. Fewer people are going to get access to that healthcare. Um, and more people are going to have poor outcomes from mental health distress. That is what is going to happen. We are going to see fewer trans people because they're not going to exist in terms of like they're not going to be alive. And that is the real problem. And that is for the role of this organization and others like it, that is murder. I'm going to say if you cause somebody to have a poor health outcome, and this is the same thing for insurance companies. Insurance companies are committing murder by denying people the appropriate healthcare practices. That is murder. And I will stand by that statement. But yeah, conversion therapy tactics and restrictive debunked screeds against trans people's medical self-determination, such as in the CAS review. And I think soon we will do an actual live stream addressing the CAS review. I have not done that yet. And I should have a while ago, but I just did not have the energy to cover the CAS review. But we will soon enough do a deep dive into the CAS review and why it is not a credible study. Because yeah, it's being presented as sound science, and that is problematic. How many people have called into the Transatlantic Call-In show and said and cited the CAS review or cited uh, a number of studies from Europe that were not conducted appropriately. So this is extremely problematic, and especially for lay people who don't know how to interpret studies. Like if you're a trained scientist and you look at the CAS review, it's pretty easy to say, I'm not going to take this seriously because I know what constitutes an appropriate study. I know what to look for in because the study, right? The study itself isn't the evidence. The results will say something or other, but it's possible to publish a paper that does not prove anything at all, or in fact disprove something. All it does is you're testing a hypothesis, and it's possible that your hypothesis is correct, and the results overturn the current standards of care and overturn our current knowledge. That's what the point of science is. But a lot of studies get published that do not reject the null hypothesis and that say we do not have enough evidence to overturn our current thinking on this particular subject. So the fact that somebody found a study that that says something or other about trans people don't exist or trans like gender affirming care is ineffective, the study itself is the argument, right? So we need to stop thinking of a study as being definitive evidence and saying this is an argument. Are the results of the study actually, like, do they actually back up the argument? Do they support this argument? Or do they not support it? And so if you go through the cast review, it shows very clearly that there's an argument trying to be made, but the way that the study methods are carried out and the results do not support the hypothesis, do not support the argument that they are trying to give you. So when we have lay people coming onto the shows and saying, well, I have a study, okay, cool. You brought an argument. Do you know what that argument says? And does that study actually support your argument? And most of the time it doesn't. So more reasons why education like this is incredibly, incredibly problematic. Especially because if you can't tell the difference going into this between legitimate psychotherapy and conversion therapy, then you're probably going to be susceptible to believing what's being spoon-fed to you at these lectures. Yeah, and these are totally full of red flags. And while scientific debate is always an important step in improving medicine, the program is full of red flags that betray a political as opposed to academic agenda. Yes. Yes. And this is the other thing, too. Health guidelines should not be based on political agenda. Yes, there should be advocacy within politics from healthcare professionals and from scientists, but the politics, the political viewpoint should not drive the science. Right? Like when RFK Jr. was saying, we're doing the studies to make the proof. That's completely backwards from how we conduct studies. Right? In that case, the political agenda is what fueled the studies, where it should be the other way around. The evidence, the uh the actual data, the studies should be what drives the activism. And so where we get pretty much every medical organization that says that gender affirming care is evidence-based and is the best practice. We have statements from the ACP, we have statements from ACOG, we have statements from AAP, AAFP, the AMA, etc. We have statements from all of these medical organizations, like expert boards, that say that gender affirming care is the most evidence-based. And we have mountains of studies that actually demonstrate that. And so that is what is driving the advocacy. So when someone brings up that point, mention that. Make sure to address the order in which we are addressing these things. In fact, Dr. Gordon Gwiat, I'm so bad with these people's names, who is regarded as the godfather of evidence-based medicine for his part in pioneering evidentiary metrics, spoke at that 2023 conference. Despite arguably being the most high-profile academic in the room, however, his presentation didn't make it into the CME course. So the guy who actually was the godfather of evidence-based medicine in general gave a talk at the 2023 conference, but his presentation didn't make it into the CME course. And probably the reason is because he had no idea that this organization was anti-trans. And thanks for stopping by, Ember. Glad to see you here. Earlier this year, Gwiat co-published a letter lambasting Segem for its anti-trans and anti-science views and practices, as outlined in a recent Mother Jones investigation into the group. And I have that pulled up as well if we have time to get into that. Gwiat said he hadn't known about Segem's sordid past when he accepted the invitation, and he has since rebuked it for its ideological and unacademic practices, calling Segem an unconscionable use of our work to deny people gender-affirming care. So and I believe, yeah, so this person who the group took the idea from, took the evidence-based medicine title, like, term from, got him to speak at their conference, which, if you're going to accept a speaking engagement from any organization, I would hope that you vet that organization, that you look into what they're advocating for before speaking at the conference, because maybe he wouldn't have been used as, like, one of the speakers or one of the figureheads for this organization. Probably wouldn't have participated. But that is just kind of funny that they're like, "Oh, we're evidence-based medicine," and then the actual evidence-based medicine people do not agree with them. Meanwhile, the CME prominently features a panel moderated by Jamie Reed, a disgraced anti-trans activist who made unsubstantiated, if not flat out false accusations against her former employers at a Missouri gender clinic where she was a caseworker. Yeah, I don't know if you all remember this particular issue. Um, I can pull this up real quick just so we can cover this as well. Oh yeah, this was the one where she lied in court. It's going about the whole do no harm thing, saying that this clinic was performing uh genital surgery, or no, top surgeries on minors, which was not happening. So she just flat out lied about what the clinic was doing for trans patients. So if we look at the population of people that are commonly the spokespeople for gender critical movements and anti-trans movements, it's all the same people, and it's blatantly lying about things that have happened. So when you're comparing two sides, like, I really hate this idea that everything needs to be, like, all sides need to be equally platformed, because on one hand, we have every major medical organization and the godfather of evidence-based medicine versus a grifter group, a grifter hate group, and people blatantly lying about what their employers are doing. Like, these should not be platformed equally. And that is something I absolutely hate about the internet. Like, just plain and simple. I hate that the internet has done this. Segem has publicly refuted its designation as a hate group and rejected the idea that it peddles misinformation. The group often uses its proximity to outliers in the trans community, like Dr. Erica Anderson, who also spoke at the conference, as a shield against accusations of transphobia or ideological motivations. Yeah, and so they'll get, like, their token pick-me trans people, and they're like, "Oh, well, this trans person agrees with me, so therefore I'm not transphobic." It's like the "I have a black friend" argument. Or, like, the same thing happened with the whole myth vision issue recently with like, "Oh, but I have a black friend who said that it was okay." No, that's not a good excuse. There's a lot of internalized transphobia, and people like Buck Angel, Caitlyn Jenner, um, have, like, they have internalized transphobia, like, and I feel bad for them, because they could live happy lives being themselves and supporting the community. And I think too, if, let's say, Buck Angel changed his mind and said that he was incorrect about his views about transmedicalism and just wanted to help the community, if he actually changed his mind on that and actually became an advocate, I think our community would embrace him. Like, they would welcome him in, knowing that he's a victim of transphobic propaganda. Like, it has affected him too. It's affected Caitlyn Jenner as well. These people are, yes, they are abusers. Yes, they are causing problems, but they're also victims of the same rhetoric. So I really feel for these people, and the fact that they think that that the right is just going to let them exist as trans people just because they believe that they're mentally ill is not true. Right? The right is not going to hold on to you and treat you like uh, a fellow patriot if you're part of one of these communities. Like, you're not going to last. They will kick you out. They'll kick you to the curb, just like they're doing with the trans advocates. And so if we're all getting kicked to the same curb, why are you trying to appease them? Why are you giving them that energy? They do not deserve it. And they're causing so much harm to the community at large. SEGM as an organization has taken great care to avoid wading into political debates, seeking only to enable evidence-based decision-making about care for gender dysphoric youth without prescribing specific policy solutions. No, that statement is a flat out lie. Right, they're saying they're avoiding wading into political debates. You're literally hosting CME lectures about why people shouldn't get gender affirming care. That's not taking great care to avoid political debates. That is launching yourself head on to attacking one of the most vulnerable groups in our society. And about seeking only to enable evidence-based decision making. Again, criteria for saying that you're using evidence-based decision making, at minimum criteria is that you should actually rely on the evidence. How about you do that before you adopt an evidence-based decision making title? Like, it's a complete lie. It is a complete lie that they say that. And another lie that they're doing it without prescribing specific policy solutions. This is a political advocacy group. They are absolutely advocating for policy solutions. We reject the politicization of questioning how to best care for gender dysphoric youth. If you reject the politicization, then actually go read the evidence and stop making this a political debate. My response is, okay, I agree with you that trans healthcare should not need to be a political issue, in the same way that all healthcare should not need to be a political issue. I would love to stop talking about the cost of insulin. I would love for it to just be covered for people. I would love for mental health stigma to not be a political issue. I would love for all of it to just be handled by the patient and their healthcare team. That is what this should be. It seems like these organizations are the ones advocating to keep it political. But, just lie about everything. That's fine, I guess. However, the group's leaders and its very foundation are steeped in anti-trans political advocacy. Yeah, just kind of like I was just saying. Before the incorporation papers were even finalized, co-founder Dr. Stephen Beck was using the SEGM moniker to advocate for Trumpian policies that effectively write trans Americans out of existence. Yeah, that does not sound like evidence-based medicine. In 2020, SEGM board member Dr. William Malone testified in support of an Idaho bill that would have made it a felony crime to prescribe hormone blockers to trans minors while leaving cisgender youth access to that same care intact. The organization has also filed a 2021 amicus brief in Arizona arguing against state health insurance coverage for chest surgery for transgender boys, plus a 2024 anti trans amicus brief during the Scrimeti proceedings. This is just the tip of the iceberg. Yeah. Yeah, and Blair White is another person with an insane amount of internalized transphobia for sure. A spokesperson for WSU, Pam Scott, told Aaron in the Morning that the inclusion of Segem in their CME offerings does not represent an endorsement of the espoused views. Then why would you platform them? If you honestly were trying to just educate healthcare professionals, right? If you're trying to educate healthcare professionals, how about you educate them according to the current evidence-based guidelines, right? And you, as the university, absolutely have that responsibility to vet what you are platforming. And if you have, especially if you have a limited space on your platform, you're going to have to make a decision of what you're choosing to offer as your CME courses. And so they absolutely intentionally platform these people. Washington State University, you are not off the hook for suspending the CME program. You still allowed this to happen. And that responsibility does fall on you. And even though you're claiming it does not represent an endorsement, it definitely is portrayed that way. That's how it is shown to the public. And this is going to be something that is associated with you that you can't very easily get away from. For the situation in question, the WSU Elson S. Floyd College of Medicine acted as an accreditor through its continuing medical education program, Scott said via email, noting WSU did not create the courses nor compensate SEGM for any of its faculty speakers for the program. It does not matter if you paid them or not. You platformed them, and that's a problem. Yeah, but when the university acts as an accreditor, it is expected to adhere to standards by the ACCME. Accreditation indicates that the courses met ACCME's requirements for scientific balance and educational integrity, Scott said. Yeah, so maybe you should pick programs that meet those criteria for scientific balance and educational integrity. It feels like this CME course violates the educational integrity aspect. Yeah, and they said they're gonna look more into this, and they ended up doing so. And of course, kind of getting into like I'm trying to skip through so we're not spending the whole show on this particular article, but we're almost done. I'll read it then. The ACCME is committed to ensuring that all accredited CME activities are valid, evidence-based, and free of commercial or other biases. McMahon said via email, while we are not in a position to comment publicly on an activity that we have not yet reviewed or audited for compliance, the description you provided raises questions that appear appropriate for an inquiry. We welcome a formal submission through our confidential complaint process. Which, like, it shouldn't be the burden shouldn't be on the people complaining about the courses. The burden should be on the university to vet them ahead of time. Right? Yeah, same comparison Ember made earlier. Would WSU think it was okay to let an organization present bigoted pseudoscience about race as if it were legitimate science? Yeah. Like, why is it okay to platform anti-trans propaganda, but not okay to platform racist propaganda? It should be not okay to platform either of them. They're both terrible, and they're both anti-science. They're both pseudoscience, and they're both not evidence-based at all. Meanwhile, Dr. M.A. Miller, an assistant professor of gender, race, and health at WSU, who researches the intersections of gender, race, and health, told Aaron in the morning that Segam's affiliation with the medical school has alarmed some LGBTQ plus community members at the university. Yeah, it should. It absolutely should. Miller was cautious to reaffirm the importance of academic freedom in this political moment. We're in this pretty intense battleground space of embracing freedom of speech, even if it's speech that we don't like, which this is not an issue of free speech. This is an issue of a medical school teaching non-evidence-based lectures. I can't say medicine, I can't say science. Non-evidence-based lectures to like present practice guidelines to teach healthcare professionals how to take care of other people. This is not a space where free speech really even matters, right? Like you can have your own opinions, but that doesn't belong to be platformed as legitimate medicine. Same thing with like we should not be platforming racist medicine on the same level as evidence-based medicine. We should not be platforming naturopathy, chiropractic, etc. at the same level as evidence-based medicine. Right? Like if we're relying on this argument of, well, just we're embracing freedom of speech, then are we going to start offering CMEs uh to healthcare professionals about giving IV turmeric because you have the freedom of speech to say that, but it's not evidence-based guidelines, and it can kill people. So should under the name of under the uh, free speech argument, should we allow for harmful practices to be treated like evidence-based medicine? Should we allow people to be harmed just because it's free speech? And should we allow other healthcare providers to be trained in ways to kill people? No, absolutely not. I hear the dog is whining. I wonder if he needs to pee. I'm trying to see if somebody can take him out. Okay. Yeah, so the whole free speech argument is absolute bullshit. State repression under the Trump regime has led to a flood of anti-trans academic attacks, such as the Texas professor fired for teaching college students about non-binary people. Which, yeah, so if you're gonna say this free speech thing, but then also in the same country, thank you, Brie, I appreciate you. But in the same breath, you're going to fire teachers for teaching about non-binary people existing. Like, but what happened to that? What about that free speech? What about the free speech for calling students by their preferred names? Like, why is that free speech unacceptable? But Miller felt lending WSU's official accrediting capacity to platform proponents of debunked ideas like rapid onset gender dysphoria, which is a quack theory painting transness as a social contagion, or exploratory therapy, which is conversion therapy, goes beyond the spirit of diverse thought and debate. It's another thing entirely to suggest that medical providers can be credentialed in something that has already been unanimously understood as not only pseudoscientific, but deeply, deeply dangerous to already vulnerable populations, Miller said. Yeah, and that's the crux of the issue that we're dealing with. Yeah, and yes, there is a vetting process, and it seems like that was not really utilized here. So, in an update on this, from when was this from? This was from the 7th. So this like past week kind of. Uh Gave an update. WSU suspends hate groups medical courses. Coalition says make it permanent. So there was a letter, and we'll pretty much focus on this complaint letter that was written. On behalf of the undersigned community organizations, including 2Spirit LGBTQIA plus groups and allied partners across Eastern Washington and North Idaho, we are writing to express our deep concern and disappointment regarding Washington State University's decision to accredit the Society for Evidence-Based Gender Medicine to provide continuing medical education courses to medical professionals. This decision is profoundly troubling. It conflicts with both Washington State's and WSU's own non-discrimination policies. Yeah, so how do you justify that? You're allowing a thing that contradicts and conflicts with your own university policies. Like, you should have vetted that long before. You should be vetting things and make sure they don't go against your own university policies before teaching it as fact, which explicitly prohibit discrimination based on gender identity and expression. By accrediting SEGM, a group identified by Southern Poverty Law Center as an anti-LGBTQ plus hate group, WSU has conferred institutional legitimacy on an organization rooted in pseudoscience and misinformation. SEGM promotes practices reminiscent of conversion therapy, which have been widely discredited and condemned by leading medical and mental health authorities, including the American Medical Association and the American Psychological Association. SEGM is not a neutral or credible educational provider. Its materials advance unfounded theories like rapid onset gender dysphoria, a pseudoscientific assertion that treats transness like a social contagion, which has been rejected by the broader scientific and medical community. Accrediting such content under WSU's name risks of giving a veneer of legitimacy to approaches that cause real and measurable harm to transgender and gender diverse people. The harm of disinformation and bias in medical settings is not hypothetical. According to 2022 Washington Post Trans Survey, nearly 1/3 of transgender adults report having to educate their own doctors to receive adequate care. Yeah, that is absolutely true. And many have been denied recognition of their gender identity altogether. In a time when transgender individuals face elevated rates of suicidal ideation and barriers to competent care, accrediting courses that spread disinformation is not only unethical, but also endangers lives. Absolutely. And I'm just reading through this because I don't disagree with any of this. I think they worded this beautifully. The standards for integrity and independence in accredited continuing education are intended to ensure that the accredited education serves the needs of the patients and the public. Accrediting SEGM's curriculum violates this principle by undermining patient safety, practitioner competence, and public trust. WSU's endorsement of SEGM's CME programming stands in direct conflict with the university's commitments to diversity, inclusion, and scientific integrity. It is not enough to simply suspend SEGM's accreditation. We, the undersigned organizations, respectfully call on Washington State University to take the following immediate actions: revoke SEGM's CME accreditation and remove all related courses from WSU platforms. Implement stronger review and oversight procedures to ensure all CME partnerships align with evidence-based medicine, professional ethics, and WSU's own non-discrimination and equity policies. Number 3, make gender-affirming care curriculum a required component of medical education and training within the WSU Elston S. Floyd College of Medicine. Yeah, so absolutely. They had a great argument here, and they had a great set of recommended solutions. So, and here's all of the organizations that signed off on this. So, yeah, so that letter was sent in, and they yeah, and so it sounds like Washington State University, at least got rid of the got rid of those courses. So one victory that we have. However, this is a fight that should have never had to happen in the first place. And a lot of that is because of the rampant transphobia and misinformation in the community in general. So uh, a lot of this is just continuing to be an issue that we have to talk about because the gender criticals do not stop. They do not stop with this. All right. We are going to switch gears a little bit. So it's same issue, but different university. So this one is at Michigan State. Oh, Michigan State Medical Society. Um, so here we go. We're gonna share this one. So this is another article by Aaron in the morning. This is from November 10th. And this is the one that Ember did more of a talk on. So if you already watched Ember's show, you probably have heard of this already. And a lot of the points that I'm going to make about, like, a lot of the points that I would make about this situation, I've already addressed with the WSU thing. But we'll kind of get into this one as well in the remaining half hour or so of the show. Michigan State Medical Society greenlights anti-trans hate group GenSpect to teach trans medicine. And yes, GenSpect is sponsored by Moms for Liberty. And if there's an organization that does not belong in medical education, it is Moms for Liberty. Let's not do this, okay? Like let's keep them out. Like they're already doing terrible things, advocating for things to be taught in elementary and secondary classrooms, and even university classrooms. But like, why would you give this organization any credibility with regard to medical education? Like, I kind of understand where people went wrong with WSU, right? Like, I get that it claims to be evidence-based medicine, which is a legitimate term, just adding in evidence-based gender medicine and twisting it around. This is the same kind of language used by the American College of Pediatrics, which is a hate group, not the American Academy of Pediatrics, which is a legitimate professional medical board. So they do like to mess with the language to confuse you. So I can see where you'd be confused and think that uh, the Society for Evidence-Based Gender Medicine was legitimate. However, on this side here, we have GenSpect, which is not at all a medical authority, which is sponsored by Moms for Liberty, which is also not at all a medical authority. So now we have like an organization that's not even passing themselves off as a medical authority trying to teach medical education, which is just bonkers to me. And of course, it's Helen Joyce, who we have. I believe we talked about Helen Joyce on this channel before with when Katie Montgomery was on a few years ago. And yeah, she is a gender critical based in the UK, saying that trans people are anti-art, which is like these arguments are absolutely ridiculous. If you think about, a lot of art people are extremely gender diverse. I think the art community is disproportionately queer because artists aren't afraid to be outside of the box. They aren't afraid to express themselves in different ways and to think about the world in different perspectives. So I think it's really odd. I think it's really odd that they're making this argument that trans people are anti-art when evidence shows the opposite of that. And yeah, Helen Joyce is not a doctor. So why are we having political activists who know nothing about medicine teaching medical education? Like, in what universe does that make sense? She says this is why trans rights groups produce art that is ugly. The trans community seeks to normalize unhealthy and unnatural body types with which um so we're getting into transphobia, but also body shaming, like unhealthy and unnatural body. Like define an unnatural body type. Like this just sounds like body shaming to me. If you insist on quality and beauty, then you're doing something that's uh oh, I can't even word to say inimical to trans bullshit, Joyce said. That's something you can all do without anyone even noticing what you're doing. Like, what the fuck is that argument? Like, you're really just you're scratching at anything possible to say that trans people are bad. It's like, oh, they make ugly art and they're body positive, therefore trans people are bad. Like, okay. I thought this was about medicine. I thought this was about teaching healthcare, but we're talking about art. Like, I'm so confused. Um, yeah, I'm just so confused about how that even is relevant. Joyce is standing at the podium in Lisbon, Portugal, at a 2024 conference for GenSpect, which is another Southern Poverty Law Center designated anti-LGBTQ hate group. Video of that speech is now being used in an official capacity to train medical providers here in the United States. The courses are provided through CME programs, continuing medical education, which is a requirement for healthcare providers to maintain their licensure. Yeah, we kind of already went over that. Joyce is not a doctor. Yeah, she's not. She is not a doctor. She's a mathematician turned journalist and gender critical campaigner. And while it's not unheard of for a non physician to be featured in CME programming, there are still national guidelines to ensure that the content meets certain standards of scientific validity and balance. Aaron in the Morning's review of GenSpec CME materials cast a light on what appears to have been an open secret. SPLC designated hate groups are peddling CME courses and using them to spread dangerous rhetoric to care providers. It's unclear how far the programs reach, but Joyce's original YouTube video, available for anyone to watch for free, sans credits, has been viewed almost 40,000 times as of this writing. Providers who want to receive credit for the CME courses must sign up for GenSpec's Substack to the tune of $180 per year. Damn, they're profiting. They're profiting off of this hatred. And yeah, too skinny to be fat, too. Not to be rude, but you ever notice that most of this comes from religion BS instead of facts and medical reports? Yeah, it really does. It really is based on religion and bias. The ACCME, the National Oversight Body for CME Programming, says that it accredits local partners such as medical schools or state medical organizations to certify CME appropriate materials. The burden falls on these partner institutions to ensure the content is up to par, a spokesperson for ACCME told Aaron in the Morning. There's a confidential complaint form, which kind of was similar to the WSU thing. If CME activity does not adhere to ACCME standards, then the host institution could see their accreditation revoked. Damn. Yeah. So if you have CME, like so, the ACCME accredits the state organizations and says, hey, like you meet our standards for being able to vet these CME programs, so you can evaluate you can evaluate what meets criteria and what doesn't, and determine the credentials. So it would make sense that if you do a bad job vetting and you accredit something that does not adhere to the standards, it would make sense that the organization that allowed that to be accredited would have their own credentials looked at. So this is risky for the Michigan State Medical Society to do. Um, and yeah, of course, they didn't reply to requests for comment, and Jen Specht, of course, didn't either. Joyce's video on gender ideology, a term Human Rights Watch dubbed a far-right Christian conspiracy myth, which, yes, it is. There is no gender ideology. It's just trans people who exist. There is a sociological, like, subspecialty, if you will, called gender theory, or like sociology of gender, or gender studies. That is legitimate. I've had people before get mad at me for saying the word gender theory, but gender theory is not gender ideology. Like, gender ideology is a fake term made up by Christians and transphobes. Gender theory is used by sociology as a way to, like, categorize the sociology of gender, how gender exists in society, how it started, how gender expression influences society, this push and pull with individuals and the society around them. That's gender theory. Right. So totally separate terminology here. And again, it's very similar to how they were using, they were kind of appropriating the term uh, evidence-based medicine and making it an evidence-based gender medicine. And the same thing with using like rebranding conversion therapy. They're intentionally using language that you already trust and blurring that line so that you can be sold different ideas because you think that the term already makes sense. Um, Yeah. So she spends a full 3 minutes out of a 30-minute lecture on Joyce's disdain for trans aesthetics. Yeah. So, I mean, just because you don't like how trans people look, that has nothing to do with whether or not they should get healthcare. That's just absolutely ridiculous. Um, she further calls on the audience to use child gender medicine and sports as an inroads to eliminate trans rights at large. This is why the puberty blockers ban is so important, she told the dimly lit conference room in Lisbon, referencing the policy that brought much of the gender affirming care in the United Kingdom to a screeching halt, in part due to advocacy groups like Sex Matters and Gen Spect. There's not that many people in the UK who've ever got puberty blockers. It's a small number. Yeah, it's a super small number. The point of them is that they're a rhetorical and argumentative device. No, no, no. They are legitimately necessary for a lot of children. And, like, don't forget that puberty blockers were first used in cis children, and they continue to be used in cis children to treat precocious puberty, or puberty that has early onset, because we do know that there are some poor outcomes with quality of life when you have early onset puberty. So we know that this is safe for minors and people who have no idea about what puberty blockers even do. And I think puberty blocker is a poor name choice, because really what they are is puberty pausers, right? Like, it doesn't stop you from ever having puberty. It just puts it on pause so that you can get access to psychotherapy and you can decide if you want to go forward with gender affirming hormone therapy, and also allows for slower dosing of hormone therapy to be appropriate for the age of the minor, right? Because you can't give an adult dose of testosterone, or you shouldn't give an adult dose of testosterone to a trans boy, but you need a high amount of that in order to suppress menses. So if you want to reduce menstrual bleeding, you have a couple options for those adolescents. Either you use a puberty blocker in conjunction with testosterone therapy, and or you use a contraceptive method, whether it be the pill, whether it be an IUD, Nexplanon, etc., which I say and or because, like, let's not forget that uh, testosterone is not a contraceptive method. Right, hormone therapy is not a contraceptive. So even though you stop menstrual bleeding, it does not mean that you are infertile. So you do need to be on contraception if you are having activities that could cause you to become pregnant or impregnate somebody else. Um, so there are plenty of applications for puberty blockers, and people that use puberty blockers end up undergoing puberty in the future. It's just a matter of, are you going to undergo your endogenous natural puberty, or are you going to undergo the opposite uh, puberty? And that's really what that question is. So they like to use healthcare for minors as a big argument and a talking point in order to say that, oh, think of the children. Oh, we don't want them. Like, kids don't know what they want yet. They don't know. They can't uh, autonomously make medical decisions, which that's a whole other subject of discussion. Is like, what is medical autonomy? Who gets medical autonomy? At what age do we grant medical autonomy? What are the exceptions? How do you get emancipated? All that jazz. Like, there's a lot of nuance here that this discussion is completely devoid of in the public sector, and that's why, like when somebody who is not a medical professional weighs in. Like, we get people all the time that call TACUS making this argument of, well, they just don't think that trans kids should get puberty blockers. And it's like, I want to inform people, but also at the same time, like, why in the world, as a physician, why in the world should I make my medical decisions for my patients based on the opinion of somebody random on the internet who never studied medicine and who just read an article that said they're doing things to trans kids? Like, that's absolutely ridiculous to think that you have any kind of medical authority to be making that call for somebody else's healthcare. Like, do you think that you should be making decisions on who get insulin and who doesn't get insulin? Like, because if you think that you can regulate hormones for minors, I'm sure you could inform me on appropriate use of insulin for diabetic minors, because that is also hormone therapy. Insulin is a hormone, right? Birth control is a hormone. We use hormone therapy constantly. And so if you can't tell me, and even so, like, these people who are trying to make claims about, or trying to make uh arguments about what healthcare should be given to minors or even adults, those people can't even tell me what the current guidelines are. Like, if you can't even tell me what the protocol is for puberty blockers, if you can't tell me what appropriate dosages are at what stage of development, if you can't tell me about any of the guidelines, why should I trust your opinion on how to change the guidelines? That's absolutely ridiculous. And that, like, I know I'm getting very passionate here, but the Dunning-Kruger is astounding, right? Like, I'm not a business person, and I freely admit that. Should I be allowed to weigh in on what people should do with the stock market because I read something online that said a certain thing? Like, no. No banker is going to listen to what I have to say about investments. I should not be offering myself up as a financial consultant because I've owned money before and I've spent money before, therefore I can advise people on how to use their money. No. No, and if I went to court, like, if somebody sued me for practicing accounting without credentials, like, if I decided I was gonna help somebody with their taxes and charge them money, and then I got them into trouble with an audit, like, that is 100% on me. I should not have been doing that, and I could get into some serious legal trouble. Even that, like, if I said, "I've read legal statements before, therefore I should defend somebody else in court." Like, sure, you have full rights to make your own decisions, about your own healthcare and your own legal representation. Like in the US, you have the right to represent yourself in court. Is it smart? No, it's not smart to represent yourself in court. You have the right to do that. You do not have the right to represent somebody else in court. Right? Even if you trained in law in another country or another state and you did not pass the bar in the state that someone is going to court in, you could be prosecuted for practicing law without a license. Like it people for some reason somehow understand this topic except when it comes to medicine. They understand it when it comes to law. They understand it when it comes to money. They don't understand that this is the same thing, that just because you read a thing on medicine online, or like you had lab results you've been told about lab results once, that does not mean you are qualified to give medical advice. Stop this bullshit. Stop it. There's my rant on that. I'm so pissed off. I'm so pissed off at these people. Like, stop doing this. Jen Specs markets Joyce's lecture as a lesson on how ideological beliefs have replaced objective standards, which, oh my God. I mean, yes, this is a concern that ideological beliefs have replaced objective standards. However, I would say that this is in reverse. This is what has happened with the gender critical movement is replacing objective standards with ideological beliefs. And that viewers will come away with a deeper understanding of how to defend evidence-based practice. Yeah, bullshit. Absolute bullshit. On YouTube, GenSpect issues a disclaimer on its videos that speakers do not necessarily reflect its views as a group. Which, okay, cool. So you have the disclaimer so you don't get sued. But that doesn't undo the damage that's happening, right? If you actually care about what information is getting out there and how the information is being utilized and who's being harmed by this information, if you are a legitimate medical organization and you care about that, and you care about evidence-based practice, you would vet this ahead of time and you would not rely on a disclaimer to keep you off the hook when you have platformed objectively problematic ideas. She does reflect their view. Yeah, and she absolutely does. Yeah, she 100% does reflect their views. And literally, this is just the only reason they have a disclaimer is for liability, is for legal liability. That's it. But as other materials strike a similar chord, in addition to Joyce's gender ideology lecture, GenSpec's CME modules advertise topics like a series on medical scandals that compare gender-affirming care to mass lobotomies, a glowing feature on the American College of Pediatricians, yet another SPLC-designated hate group founded when it split off from the AAP to target same-sex couples' rights. Yeah. Yeah, absolutely not. Plus a panel for Rapid Onset Gender Dysphoria Awareness Day, a reference to the discredited effort to invent a diagnosis of rapid onset gender dysphoria, which positions transness as a social contagion. The ROGD panel was sponsored by at least 4 other SPLC designated hate and or extremist groups, including Moms for Liberty, known for inserting conservative extremism into public schools and stoking political violence. Yeah, so we have Awake Illinois, Courage is a Habit, Moms for Liberty, CBC, PC, Our Duty, Restore Childhood, XXXY. Yeah, so a lot of garbage. It is essential that clinicians are informed about the full range of approaches their patients may be using, and that CME is a place where clinicians can learn about and debate controversies. ACCME guidelines read. Thus, CME providers need to develop activities that encourage free and rigorous scientific discourse. Emphasis, I'm going to say here, emphasis on the scientific discourse. Like, this should still be based on evidence-based science and not pseudoscience. Yeah, while ensuring that faculty do not advocate or promote unscientific treatments and that clinical care recommendations are based on established scientific consensus. In late October, Aaron in the Morning published an article about how another GenSpect adjacent SPLC brand hate group. Yeah, so that was the one that we already addressed with WSU. So yeah, here's some of the courses that they are advertising. What we've learned about rapid onset gender dysphoria, how gender ideology breaks medicine, science, and society. When perfect storms collide, the ecological origins of the rapid increase in medicalization of transgender dysphoria in youth. Wow, that is a mouthful. Reflections on the parents of trans identified adolescents not getting through how to communicate with gender questioning adolescents. This is such garbage. The series is just one part of a years-long international campaign against human rights using weaponized pseudoscience. And that really is the term here, weaponized pseudoscience. That hits the nail on the head. The Southern Poverty Law Center found this practice has become increasingly commonplace, that prejudice and hate has been dressed up in lab coats and given undue credulity through trusted institutions, and that the scientific method and industry best practices are, in some cases, being swapped with anti-trans propaganda. In recent years, anti-LGBTQ plus pseudoscience has become a prominent component of anti-LGBTQ policy networks who want to disguise their bigoted motivations with seemingly objective language. An SPLC report said these networks help translate anti-LGBTQ plus pseudoscience into legislative and legal campaigns to limit bodily autonomy and LGBTQ plus people's human rights. Yeah, and all of this does hinge upon bodily autonomy. And if you advocate for bodily autonomy in general, if you are in favor of reproductive rights, that is a reason to further support gender affirming care in the trans community, because this really is just getting a foot in the door to allow revoking rights to bodily autonomy. Right, like that is really what this issue is about. This is going to lead into gay marriage. This is going to lead into abortion rights, contraceptive rights, etc. So it's really, really important that we hold this line and that we don't allow these pseudoscientific practices and pseudoscientific organizations to take a foothold in our academic institutions and in our social institutions. So all of this was to make y'all more aware of this, more aware of the current events. And I'm sorry for the dog screaming in the background. He is sitting outside the door. But we're just about to wrap up anyway. So does anybody in the audience, sorry if I move back a little bit, anyone in the audience have questions, comments, kind of before we wrap up today? Some announcements for the upcoming day. Normally, I would do this stream later in the day. I actually think we're going to keep this at the earlier time slot because we get the raid from Bree earlier on in the show, and I think more people want to watch this show earlier. So I think this will probably be the new time slot. And today, there is a new episode of Holy Spirits. Which I'm trying to pull up the link here so you all can go catch that. The dog is saying hi. Here we go. The link. So this premieres, Holy Spirits premieres at 5 p.m. Eastern time. So definitely stop in and watch it. This week is about Norse mythology and Egyptian mythology. So check it out. It's a super fun time. Other than that, I am on LineCon this afternoon. If you're a patron of the line at a certain tier, you'll be eligible to watch that. Talk about anti-vax issues. Oh my goodness, that dog. Are there instances where a child is given appropriate medications to go through the desired puberty at the same time as their peers? Or do all trans people go through puberty later in life? No, they do. The goal for trans youth that get started on puberty blockers, the goal is if they are going to end up transitioning, that they undergo it at an age appropriate rate. So so yes, I think it kind of in my generation, of course, and the generation before me, and the one kind of right after me, kind of missed the opportunities for that because it wasn't readily available. But I think now that we have better guidelines on using this, I think the goal is to get them on an age appropriate puberty timeline to be on the same page with their peers. Any convos on what they're going to do to prevent this in the future? I From what I can tell, WSU and the Michigan organization have not given statements about that topic. Like they have not responded about that. I hope that they're going to look into how we properly vet this better, but they haven't said anything yet. Hopefully they do take initiative and start doing that. Any other questions? Yes, Line presents LineCon online live, a Line production. That is a tongue twister. I'll give it another second. All right. In that case, I think we're going to wrap it up. Any other questions, feel free to put in the comment section down below after this stream is done. Thank you so much to everyone for being involved today. It was a good crowd, and I hope to see you all in the next one. Bye, everyone.